In this video, we will discuss about CAR T cells with the bifunctional fusion protein that they have identified in the previous experiments. That the best combinations that works with CAR T is this anti-PD-1, anti-PD-L1, and this interleukin 12. So they wanted to check this bifunctional fusion protein combinations with a specific CAR T on a specific tumors. So this time they have used their ovarian tumor models, that is ID8 model, on the mice, and in order to target that ovarian cancer model, they use this TAG-72 CAR T. This is the TAG-72 is the antigen against which this CAR T work, and this TAG-72 expressed highly on the ovarian tumors, and that they call them as ID8 MSTN. So what they did is they inject these tumors into the mice, and the mice has, and these tumors also has a firefly luciferase, so they can visualize the tumors in the mice. And after 14 days they inject these T cells, and after that, after the 6 days, they check the blood plasma and the tumor collections. So in this they have not mentioned about the immunosuppressions, but that could have been done because that is the normal process before injecting any immunotherapies. So what the results that they have seen, so they have checked the results with the interleukin 12 combinations are shown here, but with this interleukin 15 combinations and TGF beta 1 trap combinations are shown in the supplemental figures. So we will keep our focus specifically on interleukin 12, as this is the optimum combinations that has the better results against the tumors. So when they use the anti-PD-1 and interleukin 12 along without any CAR, they do not see a tumor. They do not see a tumor. They do not see any tumor diagnosis, whereas on the other hand, they see a increase in the tumors with time. And when they use only TAG-72 CAR, in that case also the results are not homogeneous. They see increase in the tumors with time. And when they use the TAG-72 CAR with anti-PD-L1 mutant and interleukin 12, they see a decrease in the tumors, but the tumors can still be seen even after some days. Like around tumors can be seen in the between 60 to 69 days. But when they use the TAG-72 CAR with anti-PD-L1 and interleukin 12, and after this initial days, they are able to see a complete eradications of the tumors in the mice. And the paper says that out of 50 days, they do not see any mouse that because of these tumors. So let us just quickly go to the results that they have seen in terms of the flux, or we can say that the T cells that are found in the different combinations of the CAR T cells treatment mice. So first, when there is no CAR T cells, only anti-PD-L1 and interleukin 12 is injected, bispecific protein is injected in the CAR, they see a increase in the T cells. And similar results they have seen when they don't inject any bispecific proteins, only the CAR targeting TAG-72. But when they used anti-PD-L1, they see a heterogeneous expressions. That's in some cases they see increase in the T cells, in some cases they see a decrease in the T cells. And then they see in the case when they use TAG-72 CAR and anti-PD-L1 and interleukin 12, they see a continuous decrease in the T cells after some times. This could be because there are no tumor cells, so T cells doesn't need to be present, as T cells works or activate. These CAR T cells will activate when there are tumors are present in the patients. So thereafter, when they check the T cells in the flux photon in this days post tumor injections. So in that case, this panel C is about the individual T cells, and panel D is about the comparisons. So in the comparisons, they can see that the T cells are decreases for this case TAG-72 CAR is anti-PD-L1 interleukin 12. This could be explained, or there is logical reason could be that since there is no tumors, there is no need to be the high T cells present within the high activity T cells present within the mice. Then they check the probability of survivals. The probability of survivals in the case where they use TAG-72 along with this anti-PD-L1 interleukin 12, they are able to see almost 100% survival rate. And even in the case where they use mutant PD-L1, they see a decrease in the survival rate. So indicating that this PD-L1 or anti-PD-L1 also has a role towards this tumor diagnosis. Then they check the weight difference. They do not see any significant weight difference. They do not see any significant weight difference in the case. They do not see any significant weight difference in the all the cases that they have analyzed. And so one thing that I just want to clarify, these signals are for the flux. This flux is basically the firefly luciferase that they have seen. So these signals are for the tumors, not for the T cells. So this arrow indicates the T cells. So the tumors are increased continuously in the case when they use interleukin, either only bispecific proteins or only the CAR targeting TAG-72. But when they used both the combinations, in the mutant they see a heterogeneous results, and in the case where they use wild type anti-PD-L1, they see a continuous decrease in the tumor signals. And this is the comparisons of the tumors in different cases. So pardon, previously I mentioned the wrong things. Then in the panel G, what it is, they check the IFN gamma in whether they are specifically overexpressed in the tumors or they are overexpressed in all the host body. In the plasma, they do not see a high increase in the IFN gamma, whereas in the case of tumors they see a high increase in the case of IFN gamma. And in the case of this PD-L1 mutant and PD-L1 wild type, in the case of PD-L1 wild type, they see a more increase in the IFN gamma. So however, these results are slightly different that we have seen in the previous video or in the previous results, where we have seen that in the case of this mutant, the IFN gamma levels are high in the serum and low in the case where wild type PD-L1 is used. So we can say that these IFN gamma results are not consistent, but the overall effect that seen of these combinations is in line with the results that they have seen in the previous experiments. That is, the interleukin 12 with anti-PD-L1 works best. Thereafter, they check the CD3 expressions and CD8 expressions. CD3 expression shows that continuously increase in the CD3 expressions increased in the case where they use this anti-PD-L1 mutant and interleukin 12. It is around 61.7%. And so CD3 expressions goes down maximum. Yeah, CD3 expression goes down, and it goes down to a maximum of around 51.1% when they use wild type PD-L1 interleukin 12, and CD8 expressions is highest in the case of this this TAG-72 CAR with wild type PD-L1 and interleukin 12. So this CD8 expressions, CD3 expressions, or cytokine expressions might depends on the type of cancer or case to case. because in the previous video we have seen that the expression levels are different. The CD8 expressions we can say that the CD8 expressions are lower in the case where interleukin 12 is there. So we have to check in the supplementary results. I haven't checked whether the CD8 expressions are high or not, or whether they have reported CD8 expressions there or not, but CD8 expressions are high, and this is a good sign because the CD8 T cells or cytotoxic T lymphocytes can act directly on the tumors, attack directly on the tumors. But overall, they shows that their CAR Ts along with their bifunctional fusion proteins, that is anti-PD-L1 and interleukin 12, gives a promising results in the in vivo studies also, where they check the specific ovarian cancer cells with this TAG-72 CAR and anti-PD-L1 and interleukin 12. So I hope you understood these results to some extent. If you need to understand more about this experiments in detail, you can go through the reference that has been provided in the description, and there is a gist all of these results are also provided in the descriptions that might help you to have a brief idea what is going on in the studies if you don't want to go through this whole video at once. Thank you for your time.